in Africa, should we be concerned about cancer? I mean, it almost seems as if what we usually know that HIV, it's malaria, cholera, typhoid, measles, dengue. Should we be concerned about cancer? Is that a real problem for us here in sub-Saharan Africa right now?
That's an excellent question. In the past, when we had a lot of difficulty controlling infectious diseases, that was the major thing we had to deal with. But now, as we have improved in our hygiene, in our kind of basic medical care, and people are no longer dying from a lot of these infectious diseases, people are living longer, cancer and other chronic diseases have become more of an issue. So there is a rising epidemic right now of cancer. So it's something that we all need to be aware of. Cancer is a big deal in all of Africa right now. And it is very important for us to be aware of what the problem is and figure out how we can prevent it or treat it when it happens.
So we know that in developed countries, for example, people get cancer. But then if you look at the life expectancy in a place like the United States, I think for women it's like 82 point something years now. For men, maybe about 71, 80 thereabouts. I mean 79, 80. So even though in these developed countries they have cancer, they still live long. They still, we hear the term cancer survivors. Whereas in a place like Africa, that's not necessarily so. So can you talk to us a little bit? Because I just want our audience to understand why prevention is really important here.
I mean, that's really a great point. The key thing is early detection. Early detection. The major problem we have with all cancers, including prostate cancer, is that patients, our people, really present late. When people come, when the cancer is far advanced, there's a limit to what can be done. The results of treatment are not as good as if the cancer is picked up early. So I think the biggest message we can, really deliver to our audience is the need to go for screening, go for checkups. It is the safe thing to do for the person and their family to really get checked early. If we detect something early, we can treat it, we can cure it. Cancer is not a death sentence. The key thing is to detect it early so we can treat it effectively.
So in Nigeria and sub-Saharan Africa, for example, with prostate cancer, because you use the word go and screen to get detected early, I know that we as black people, black men, have a problem with prostate cancer.
Yes.
What other, is this something that should be like automatic, that when we get to a certain age? Talk to us a little bit about, why it's important for that screening to happen and what exactly you mean by screening.
Okay. Now, there are certain predispositions, there are certain things that make somebody more likely to have prostate cancer. In black men, for instance, we are more predisposed to have prostate cancer than white men. And it tends to be aggressive in black men.
Do we know why?
It's still being studied. It has to do with genetic disposition. So the specific reason is not clear, but in certain races, in certain families, there are abnormalities, there are inherited things that can put us at a greater risk than others. So it is important for every black man, and generally every man, to be screened. There's some controversy about prostate cancer because prostate cancer can be aggressive or it can be somewhat indolent or somewhat quiet.
Yes.
So if it's a quiet type of cancer, then it's probably not as risky. But a lot of the prostate cancer that happens in black men is aggressive.
Yes.
So I think it is very important for people to go and be checked. The recommendation for somebody who is at really high risk is to be checked every year or every 2 years from the age of 40. Some people would say 45, but I generally would like to advise people to, from the age of 40.
Okay.
What tests do? We do a rectal exam. So this is
Men don't like to hear that.
I know.
Well, you have to tell us what it is.
I know. Well, so a doctor in general would, have do an examination. It's a lubricated exam where somebody feels the prostate gland through the rectum.
Okay.
But it's not, I know it's somewhat uncomfortable, but it's not painful. And it's a very brief test that only takes about 30 seconds.
Okay.
So, but it is, having a little discomfort for 30 seconds, not pain, but discomfort, is much better than detecting something when the cancer has spread all over the body.
That's right.
So I think it is important to do that every year or two from the age of 40, and then to do a test. There's a simple blood test called PSA. And that is a certain antigen, a certain substance that is released by the prostate gland. It doesn't only get released if somebody has prostate cancer. If somebody has an infection in the prostate gland or has a non-cancerous enlargement of the prostate gland, this PSA level can be elevated. But if it's elevated, then one can begin to test things.
And find out why.
Why it's elevated. The person might need to take some antibiotics and see whether it comes down. But if it's persistently elevated, then there might be a need to do a biopsy.
Yes. And what is a biopsy?
A biopsy is essentially a test where a little bit of tissue is taken with a needle
from the prostate
gland for the pathologist, a doctor that looks at things under the microscope, to go and look at the cells and see whether the cells are normal or abnormal.
Okay.
Yes.
All right. So you're recommending that black men, every black man from the age of 40 should begin to have screening for prostate cancer every year or 2 years.
That's right.
Okay.